Welcome to A Closer Look. I'm your host, Linda Fontaine. Today I have the privilege of interviewing Mike Shoulders, an insurance broker. Welcome to the show.
Thank you, Linda. I'm happy to be here.
Well, tell me, health insurance. I am so confused these days about health insurance, and that's why I called you, because I thought if I had this issue, I'm sure I'm not the only one. What's going on?
You know, Linda, I have been in this business about 40 years, my wife about 30 years. So we have a great deal of experience with it. And the last few years, there's been more confusion than ever. It's always been a mystery to a lot of people because it's so difficult to understand all the language, first of all, and then the ins and outs and the 80 pages of legalese that are in every contract.
Yeah.
So it's very difficult, but since the Affordable Care Act was passed, also referred to as Obamacare, there has been probably more confusion than ever.
Oh, absolutely.
Yes, and now there are a lot of government requirements and restrictions, so what worked in the past won't necessarily work now, and there are deadlines associated with a lot of the coverages also that didn't exist before. An example is if you want an individual medical policy, you have to apply for it. There's a period of time at the end of the year where you have to apply for it. And in your son's case, who we were talking about that brought all this up, any changes had to be made by a cutoff date. And last year it was December 15th.
That's so confusing. And why should there be a cutoff date?
Well, there was a cutoff date because now with one of the provisions of Obamacare, which is good for many people, there are no underwriting requirements. Everybody's issued regardless of their medical health. There are no pre-existing conditions. So someone who comes on who perhaps has stage 4 cancer, their coverage is going to go into effect for that cancer on day one.
And that's great.
Yeah, it's terrific. But that also affects and impacts the costs, because now the insurance companies are paying claims that in the past they wouldn't have paid or they would have put off until a waiting period was satisfied. Now it's immediate. And because of that, they simply can't allow people to come in March 1st, June 1st, or whenever they want to. There is an exception to that. If somebody has a qualifying event, for example, they lose group medical coverage, or they start on, they have a baby, or they marry or divorce, there are reasons that will qualify them throughout the year. But on individual policy, the effective date is always the 1st of the month, and usually the 1st of January. The 1st of January is also when rate changes will occur. And each insurance company will file with the Department of Insurance of the particular state. We're in Tennessee, so the Department of Insurance in Tennessee, they'll file for rate increases, and they'll justify the reasons why they feel like they should be entitled to the rate increase. An example, Blue Cross, oh, and by the way, there aren't many insurers that are left, and especially in the individual market. Blue Cross and Humana are the only two names that you would recognize that will sell an individual policy. And the reason for that is because there were such incredible losses that were incurred by the insurance company on the front end in that particular market. The individual market is separate from the group market. Their claims are separate. The premiums are separate. Everything is separated. So in the individual market, there have been extraordinary losses. And particularly a couple of years ago, Blue Cross a couple of years ago on January 1st of 2017, they requested and were approved for a 62% across the board rate increase on their individual products. This year, 2018, on January 1st, there was a rate increase of 23%. Plus people are reaching an age older, a year older. Everybody's a year older, obviously, from January to January. And in your son's particular case, he turned 21, and therefore he went into a higher bracket.
Well, he's not even 21 yet. He will be
He
this
will
year.
be 21, right, correct, that's it, right. So during the calendar
During the
year.
year.
Right, and so we talked, and it is more or less a perfect storm in your son's situation. some people, those who are eligible and qualify for government assistance for, again, Obamacare is what people refer to it as. There may be some compensation or some way of getting the premiums down by going through the government and going through the Obamacare websites, the healthcare.gov website. And by doing that, though, certain criteria has to be met. You have to have an income, and it has to be a minimal income and not, above a threshold amount, and I believe that threshold is $12,900 annually, and then below a certain amount, which again it changes every year, and you know how the government does things, it's incremental, but I think it's about $42,000. But in between there, you can qualify for some subsidies, but you've got to be very careful when you do that, because you are liable for any mistakes or errors that might be made in reporting your compensation. For example, you might have earned $15,000 last year, or someone might have earned $15,000 last year. They anticipate making $15,000 this year, but they get an increase, a raise, or they get a promotion, and they make $25,000 instead of $15,000. Well, guess what? They're going to owe some of that subsidy back, and it's taken out at tax time, or they're sent a bill for it. So it can be very difficult and very confusing. And the product it also has changed. Using Blue Cross as an example, Blue Cross on their individual market had about 70 or 80 different products that you could elect. There were a lot of different combinations. You might want a $500 deductible, and then which is what you pay out of your pocket first. Then 80% co-insurance, meaning the insurance company pays 80%, you pay 20%, to $1,500 max out of pocket, meaning at that point, once you've spent $1,500, the insurance company pays the balance for the calendar year. That was a pretty popular plan.
Yeah.
It's not offered any longer. Now the plans are determined by the bronze, silver, gold, or platinum levels that again were established by the government. And each level has certain actuarial values, meaning that so much that's taken in premium is paid out in claims. The bronze is the lowest level, meaning that you're going to find some high deductibles. We're looking at a schedule here on this plan, a $5,600 deductible, and then 50% co-insurance. The insurance company pays 50%, you pay 50% until you've paid over $7,000 out of pocket. The value of this plan, obviously, some claims, I mean, we see 6- and 7-figure claims.
Yeah.
So they happen, and they happen around here. I had one claim that was over $3 million, and I've had 3 over $1 million. So, you know, personally, I've been personally involved with.
Wow.
Didn't happen to me, but my clients.
I understand.
And so, you know, it's not unusual to see those kinds of claims, but this will obviously protect you against that. But more importantly, it will also, if you stay in network, and if you deal with major insurance companies, they have great networks. Just stay within your network of providers, hospitals, doctors, clinics, and so forth. When you do that, you're going to get discounts. Sometimes the discounts are extremely good discounts. I mentioned to you earlier, I saw one just a couple of weeks ago from a local hospital that had billed $27,000 in charges, but it was reduced to $1,250 when the insurance company applied their deductions. And the hospital agrees contractually to accept that for their services. And I see other cases too where the savings aren't nearly that dramatic. But kind of a rule of thumb, you're going to save about 1/3 at the doctor's office and about half on radiology, and sometimes 3/4 on surgery or inpatient hospital stays.
How do you get that?
Again, by staying in the network, and they have contractual agreements with the insurance company.
Just the contracts, okay, so that's how you get the special discounts.
So if you walk in off the street for a particular procedure, it might be, let's say, $1,000. But the insurance company has negotiated beforehand with that facility that they're going to pay $400 for that procedure
Oh,
in
okay,
exchange
yeah,
for sending
right.
people
Gotcha.
to you. So, you know, it's kind of a win-win type situation. The insured person who goes in for the treatment gets the discount, but the facility gets the traffic.
I gotcha. Okay, that makes sense.
And in doing that, it helps the insurance company keep costs down, but again, the costs have simply been going through the roof. And not only,
Yeah.
not only do the new Affordable Care Act type policies, you'll see reference to essential health benefits, all these acronyms, EHB, ACA. The EHB is the essential health benefits. That means that the policy qualifies under the Affordable Care Act as an eligible policy that has preventative care benefits and other such mammograms, pap smears, routine physical exams, flu shots. Those types of things are covered 100% with no deductible, no co-insurance.
Wow. There's so much to know and learn, and we have a lot more to talk about because I'm still trying to figure out what I can do about my youngest, who's, like you said, he's in the perfect storm. He doesn't make enough for Obamacare, but he's in a situation that he can't really afford the insurance. And I've got a lot of questions regarding what happens if you don't get insurance with taxes and things. And we'll come back with more information, a lot of questions, and I'm learning a lot. We'll be back in just a minute.